So this is a series of exercises for like a post-surgical wrist injury or fracture, particularly like the radial fractures where you get the bone misplaced and they have to go in and put some hardware in there. So open reduction internal fixation, which is like a little titanium plate. They have some little grooves that notch into the bone, riveted in potentially. Carpal tunnel releases, things of that nature, where you're in an immobilization for a while and you're now in this phase of trying to get out of the splint. So at home, when you're sitting, I don't encourage a splint for those situations. I encourage a lot of movement. So if something's stiff in all directions, including finger grip, finger opening, wrist flexion, wrist extension, deviations laterally, and rotation, those are basically all the factors we want to get going in terms of rehab. So first things first, if it's really sore to the touch and very sensitive, then you're going to massage that sensitivity out of the area where the incision or the scars or the swelling is. So if you start up by the elbow or the upper forearm and you just start to grip like the little duck finger mouth grip and work on your muscles where you're comfortable, and half inch by half inch, you're working your way down, and so let's say right about here, oh, that's right about the soreness. So I'm going to work on that perimeter of the pain and just rub that out for 3 to 5 minutes. So look at the clock. It's I don't know, 4:24. So at maybe 4:30, I'll stop. And if it's sore, I'm going to back off up towards the elbow a little bit and rub that out. Over time, I should be able to, degree by degree, work my way down over that area until I'm able to rub and grip and squeeze that skin in that forearm and that swelling area, and should feel fairly normal, okay? After a surgery, if they do a repair, all those screws and those rivets, that bone is now fixated, just like screws and wood with glue. That area is stable. The nervous system, on the other hand, doesn't know that the surgery was done and fixed everything, so now you got to convince the sensitivity of the nervous system that everything's okay. So by going in and getting comfortable with grip and squeezing and rubbing and touching and milking that hand, that will help set you up to be able to stretch and strengthen better. Because if you can't touch it, well, how the heck are you going to stretch it if you can't even touch it? So work out the soreness to sensitivity to pressure. From there, you can use the other hand and try to massage your good arm and start working on your strength that way. And you may have maybe 1/10 the power here, but the point is I can grip and try to work and move my hand around just like I was doing on the other side, and then eventually grip and wring my hands out together. So that inherently is going to work on gripping, desensitization, and the whole package. A ball, like a tennis ball, is a nice little tool because let's say this is my bad arm, this is my good one. I can play catch, I can roll it on my palm, I can try to grip it and hold it with just my little finger and my thumb, then my ring finger, and then my middle finger, then my pointer finger, and then over here, see if I can up and play catch or throw back and forth. And again, here, try to hold it gently. And over time, as I get more comfortable with gripping here, I can start to grip that tennis ball and just roll it around as well. And that starts to strengthen my grip. As time goes on, that stiffness in the fingers should go down, and I should be able to make a full fist. So opening and closing the hand in a fist obviously is a good exercise. Or I could just take a face towel and roll it and just try to do an imaginary wringing of the towel this way, and I can go the other way and twist the other way. So little extra, just almost things that you would do normally in a day is gripping and squeezing and wringing, opening jars. Those kind of exercises can be mimicked by taking a towel, trying to hold, and I'm just only doing maybe 1/10 of a jar opening motion, but I'm getting all these muscles working in a functional context. And eventually, that should carry over to me being able to use this post-traumatic situation as a normal prop again. If I want to start trying to get this hand into daily activities, instead of wearing the arm splint, I can take the splint off and use my own hand to act as a splint, very gently, like I'm holding a handshake. And now things like putting the silverware away from the dishwasher, I can use this hand to try to grab the fork, open the drawer. I'm just doing everything with this hand being held by my this wrist being held by my hand. And now I'm protecting it, but I'm also trying to encourage a functional reach, putting things away, putting this towel, maybe even try to see if I can fold this on a countertop and use that as a daily activity. Brushing the teeth maybe with an electric toothbrush, holding the wrist, that vibration through the bone, all that stuff is very stimulating. And this is my natural cast, but it frees me up to reposition my wrist and try to functionally move things around and stretch and strengthen all at the same time. That's probably the best way to get yourself back to normal, is to try to take it into a normal situation and give it a little support in the beginning, just like using training wheels on the bike, and then slowly removing those, holding the seat, running along with your child. Just hold on and help that. And eventually you'll find yourself going and go, oh, I just reached for the milk without it. Ooh, that was a little heavy. But then you start making those little, oh, I forgot that this is injured. Well, that's a good sign that you're getting better, right? So if you have a surgery with screws and plates, those bones are not coming apart anytime soon. That is fixed. Your nervous system, and yes, there's some final healing that needs to occur with that, but those screws and those rivets are not coming out anytime soon. So at that point, you're no longer dealing with a broken bone. You're dealing with all the things that cut to get that stuff in there to fix the bone. Now all those nerves to open up and get the hardware in, that's the problem, right? So that's where you're needing to recover. If you have a fractured wrist that was in a cast, well, you immobilize it without the surgery, and after 6 to 8 weeks the cast comes off, that bone's ready to roll. Same situation. You can do the same thing we just talked about for that. So in either case, this is a good strategy and a way to go after trying to get that hand back to normal, rather than worrying about every little knuckle. Just, can I functionally make a full fist and open? Well, if that's the case, I can compare it to my other side. If I can go back this far on this wrist, well, I'll at least do the same. If I can go here, well, then my goal is to try to match the other side. I can do the hand praying and stretch my wrist back this way. I can take the wrist and fold down this way. Lots of things. Just get it out of the splint when you're sitting and resting, and work it, milk it, rub it out till it's no longer tender. Once it's no longer tender to the touch, start really emphasizing the stretching and making and helping the fist move. And once you feel like you have a fairly good amount of mobility, then start working on things like dexterity and playing with a ball, making bread dough. All those things are really good for the wrist and the fingers. So that's really just a generic, keep it stupid simple KISS method of self-rehab. So good luck with that, and see if that works for you.